you, and good morning, everyone. We hope you're looking forward to this inspiring panel of experts, where we'll be discussing how AI can put the data into the hands of clinicians to accelerate the diagnosis of rare diseases. Now, rare diseases affect an estimated 400 million people worldwide and remain one of the greatest diagnostic challenges in medicine. Patients can wait up to 5 to 7 years for a diagnosis, often seeing multiple specialists before getting the answers. Now, the challenge isn't only in the rarity of each condition, but also in the fragmentation of data across systems, which is often buried in clinical notes. And this is where AI has great potential to improve patient outcomes. But innovation alone isn't enough. And it's only when we break down silos across sectors that we can move forward together. And that's exactly what brings us here today. So, Virginie and Philippe, when we talk about moving from innovation to clinical impact, can you take us through the reality today?
Thank you, Susanna. So, to my point of view of a neurologist specialized in rare disease are really challenging to diagnose because of their clinical heterogeneity. And Friedreich ataxia is one of them. It's a progressive, inherited degenerative disease linked to an expansion of the FXN gene. The diagnosis confirmation is based on the molecular identification of the expansion, but after a first step of clinical suspicion. Friedreich ataxia, first hallmark is progressive ataxia, but it is also a multisystemic disease with different manifestation on extraneurological manifestation, cardiomyopathy, skeletal abnormalities, pes cavus, scoliosis, and diabetes. And this very broad heterogeneity makes the diagnosis difficult to do, and there is a long diagnosis delay, on an average diagnosis delay of 3 to 6 years, and longer for atypical phenotype. It's really important to make an early diagnosis because it allows to initiate the planned care for a patient to access emerging therapies and clinical trials. Philippe, what is your point of view?
Yeah, thank you, Virginie. So the main question we had with Virginie about the FA, Friedreich ataxia, is how can AI improve the identification and the detection of the patients that could have the disease to improve the early diagnosis. So as a neurologist and also as head of the innovation department of the University Hospital of Angers, we tried to ask whether AI could improve this delay. But as you mentioned, there are some limitations and challenges when we are considering the rare neurological disorders. The first one is that the disease is very heterogeneous. The patients, they have neurological symptoms, but also they can have systemic symptoms. And also the disease onset can be very early or very late. Even in the same family, the disease onset can be very different. So the trajectories of the patient can be very different within the same hospitals. So if you want to detect the patients based on the text, on the textual, the medical records, you have a high volume of data and very different trajectories. So you cannot rely on keywords or old-fashioned AI. You have to consider new approaches in AI. So that was the first question we had with Thibaud, saying, how can we use these new approaches to try to detect the patients? So we thought that the University Hospital of Angers could be the good choice to start a partnership and to start this kind of project, since we have the medical expertise with Virginie here, Dr. Pichon, and the reference center of the disease. And also we have the department of innovation that I'm leading for the medical part, innovation and AI, we have a team dedicated to this question. So we thought that it could be the start of the project. And also, we have quite the good size for a hospital. We are big enough to have the experts and the patients, but we are not oversized. So we have this flexibility, we have the capacity to build this kind of project very quickly and to lead this kind of project. So this is how we met with Thibaud to start to talk about this, to speak about this project.
I think, Philippe, like he mentioned, we are very pleased to be here today, not only because we have a dream together, I think, to try to change the care pathway of people living with sometimes a disease that they don't know about, which is Friedreich ataxia. And so from this dream, we're here today also to announce that we are about to sign a partnership today together with CHU d'Angers and together with Codoc to really crystallize this partnership that we have enabled already together to try to transform this dream into a reality. And the name of this project is called AXIA, for Ataxia and AI. And so this is what we are going to talk about now during the next minutes. So,
fantastic. Thank you, Thibaud. And we're really looking forward to seeing AXIA develop. Arthur, let's focus a little bit more on the technology now. So, considering the complex data challenges that we've mentioned, particularly with AI, can you talk us through how Codoc leverages AI to deliver clinically actionable insights?
So, Codoc was born in a hospital. It's a company that's a spin-off from a hospital. And what Professor Codron said is really true. There is a massive amount of data that's produced during care, but it's mainly unstructured. It's really heterogeneous. You have dozens of data types, and it's siloed. So our focus with Codoc is to make this data usable for care and for research. It's a massive untapped value. And of course, AI is really powerful to enable usage of this data. So our focus is to democratize data usage, meaning that the one that create the data, produce the data, should be able to use it. So specifically in rare disease and in FA, so you have 7,000 rare diseases, and it's 2 million person in France, 100 million person in Europe. So it's massive issue at stake. But with many diseases and complex phenotypes, progressive evolution of diseases, and that's where AI actually helps. So what we're doing in FA specifically is that we are creating patient archetypes. So that's a model of the patients with everything, every science that describes a patient in real clinical setting. And with this archetype, we are able, in these massive collective memories that's created in hospitals, well, to find similar patients. And when you find similar patients, our approach in the AXIA project is to show the clinicians the 20 to 30 cases that are the most similar to this archetypal patient. And this then empowers really clinicians to take action. So this approach has been developed in Necker Hospital first, so Necker Children's Hospital in Paris West Bank, just across the Seine, and we were able to find patients and change the care path. So we are building actually on scientific evidence that have been built over the years, and that we are scaling today.
And what about the aspect of trust, Arthur? How do you go about working closely with the clinicians when implementing kind of this new system?
So it's we are creating a trusting environment, and that's of course it's key. The main aspect is that we are gathering a medical community, so there's medical validation at every step of the process. There's scientific evidence, but then there's also experts that are part of creating the algorithm. The second part is that you need full data traceability, transparency, and also explainability of what you're doing. And all this is embedded in Codoc technologies because since the beginning we're working with healthcare providers. So this means secure workspaces, data pseudonymizations, patient information in user-friendly platforms. All this is embedded in the project. And maybe the last part of this trust environment is no wait, that's it.
Yeah, one more touch point.
No, excuse me, I got the point back. Is of course the feedback loop we are creating with the clinicians, meaning that when you build the algorithm, then the doctors need to assess it. And to assess the algorithm, they must go back to clinical notes and clinical data. And so the Codoc environment enables interaction with this data. And so it's meaningful then for the clinician to get in the loop. It's not only about data science, it's really a complete environment for working on the data and making sense out of it.
Thank you, Arthur. And just one more point on the scaling opportunities. What kind of opportunities do you see with things like the implementation of the EHDS, for example, and the current status that we have of regulation, for example, in France, but also moving beyond and across Europe in the future?
Yeah, so it's the environment is French, is quite exciting today because the data is more and more accessible. 7 years ago, we were not in the same situation at all. Now, it's not only university hospitals, but also private hospitals, primary care, public private hospitals that have invested to gather their data. So that's actually, it's accessible. There are regulatory hurdles. But let's say that once you overcame it, you're set for scaling in other countries, other contexts. And then, of course, for European scale, the European health data space will be an accelerator too.
Fantastic. Thibaud, once we have the technology as described by Arthur, how can an industry partner also help ensure that real clinical impact?
Thank you. I think this is where Biogen try to play a role indeed. So what I would say is that first point, for those who doesn't know about Biogen, we are a US-based company that is a mid-sized biotechnology company. We're kind of a big group of passionate people about rare diseases, but also about diseases where there is no solution. And today, our company, we're trying every day to find solutions, and in particular medicines to bring to patients that doesn't have any solution. And here with Friedreich ataxia, we believe that we have also not only the role of bringing new medicines to the patients, but also solutions to improve the care pathway. And one of the challenges that we are trying to tackle together is really this idea that patients are suffering and their families every day because they don't have a diagnosis, and they could benefit from care and potentially in the future from novel medicines. And so this is why we're here as an industry player, but why we believe that we can succeed together. First of all, you've heard, because we hope we're partnering and from the beginning with some of the best experts in France in AI as clinicians, but also in rare diseases. Some of the best companies and startups in AI, but also in a very specific environment in France. I think for those who doesn't know about it, the specificity of France is that we are very centralized, which is sometimes a challenge, but also an opportunity. Today we have this chance in France to have a networks in each of the rare diseases, of experts and of hospital university hospitals like CHU d'Angers. And CHU d'Angers and Virginie, you are also the representative of one member of this network that are working together to try to tackle these issues. And so together we believe that by bringing this network together, by bringing all the players together into one direction, that we are trying to on one goal to tackle, we have more chance to succeed. One additional thing is not only the players that are here today, but those who sometimes, maybe some of them are here in the public, but some who are really supporting us and this project. We have to talk about the fact that in France you have something that's called CSF ETFs. CSF is a Comité de filière stratégique, or a strategic committee of the industry, the healthcare industry, which is kind of a safe space for industries, industry members, but also for the public sector to come and join together forces to discuss first, and then sometimes not only to discuss but to create things. And one of the things that we have decided as partners together to bring together is not only discussions but an association. And so there is an association called Radar that has been created really recently, and it's going to be officially announced like in a few days, because you know the administrative I would say organization in France can take a couple of days, but this association Radar is really focused on one goal for the public and the private sector, which is really to enable public and private players to work on the opportunities of AI in rare diseases, and in particular in reducing the burden of the diagnostic delays in rare diseases. And so together with these players are joining forces, and they have been identifying to start 4 projects that have been supported by this association. And one of them is Axia that we're talking about. And so just to remind a couple of things about Axia, the first step that we are working together that is enabled by Codoc and by CHU d'Angers is really this idea of demonstrating that the algorithm that will be developed by Codoc can truly identify the patients, the people that doesn't know about the disease they have, that they have a high probability of having Friedreich ataxia. And if they have this disease, and if we validate that, potentially the next step is to get into the broader network, and in particular the network that CHU d'Angers is, which is kind of a top of the nudge, I would say, network in the way they are structuring their data in France, which is the Réseau Hugo. And potentially into another level, which is the step after at the national level. So this is what we truly are trying to achieve. Then, the role of Biogen, what we are trying to achieve together and what we are trying to bring to the table is really kind of having, from the beginning, I would say, I hope, and I think this is what is building strong links between all of us, is that we're trying to, first we have the first goal, but second we are trying to build true relationships. Not only, sometimes in our industry, a partnership is kind of a story of money from a side and execution on the other side. Here, we are different partners bringing their expertise with physicians, clinicians that are bringing their expertise of the disease, their expertise of having the patients into their organizations, people that know about AI, but also that are coming from research and are trying to bring that to the clinicians, and us as Biogen. We are trying to help organize this. First of all, we've been aligning all together on how to work on a strategic manner. So very concretely to organize a governance between all of us. Not only the 3 of us, but also making sure that this is overarched with this association I was mentioning about, to make sure that this project is not only made for Biogen, but is made for the community and is made for each of the players, but also the other players in rare diseases. And then also to make sure that together with this association, we can leverage the network of this association to find sometimes money and also ways of scaling this project into the next steps that are coming up to us. In terms of the questions that you may have is what could be the KPI of such a project? Because you know, it's always good to talk about projects, but in the end, what's behind all of that in terms of what we're going to measure, how we're going to measure the success of such a project? So these, and transparently, these are questions that we are asking each other, but some of them are pretty straightforward. The first one is we have the same goal of reducing the delay of diagnostic of patients. The mean time of diagnosis for Friedreich ataxia is around 5 to 6 years. But from some forms that are difficult to identify, it's more around between 8, sometimes 10 to 15 years for some patients. So here we have a clear number that we can track and see if we can change the trajectory, I would say, of these patients. The other point is that we want to give back also time to the organizations and to the clinicians. Like, I think the partners and the physicians that you have here, they would love to have these patients identified and coming back to them. But for many other HCPs, in the hospital in particular, they are meeting these patients regularly. But they don't know why. Like they are meeting them for some symptoms, for some issues. But in the end, they are turning around into the system. This has a cost for the system. And this is time that is sometimes wasted for some HCPs that could give this time for other patients that need it. And finally, we believe that there is also a way in the future to bring to the physician, to the clinician, kind of a data-driven pathway, like where the pathway could be smoothened, simplified, and really at the service of the clinicians, so that the patient can have less burden, but the HCPs as well into the organizations. That they will talk better about it than I do, but that is difficult in every country today, and in particular in France, where they were talking with me a little bit earlier about the numbers of patients that they are seeing every day and the agendas that are pretty crazy that they have. So that's also the reality. And maybe the last point is, all of this is not only about Friedreich ataxia. This is what we are pursuing together, and we need to have a concrete goal. But this is also about all the rare diseases that are behind that could pursue the same goal. And I know that Philippe, for example, is really excited about the possibility of expanding this project into other rare diseases. A couple of them that he has in mind that maybe he will talk later.
Thank you so much, Thibaud. And maybe just one last open question for all of you on the panel. So, although we're still in kind of some of the initial phases of the project, it's a really good example of how different stakeholders collaborate together and working towards one common goal. And I guess maybe some of the audience are asking, how do you balance all of the different priorities that you have as different stakeholders to really work together to then pull off the project, so to speak?
Yeah, it's a very good question. I guess the success of this project is based on what also Thibaud said, is based on the expertise of each of us, and also the willing of trying to go forward and to try to get a solution for the patients. That's again what you said. We really want to get a solution to improve the clinical our everyday life as a physician. So that is why the balance, I guess, is found. We all have a goal in mind, and we have a common goal, and knowing each other is really a good thing to go together to this goal. So I guess it's that.
Arthur?
Yeah, of course, it's that's what drives us. It's the impact for the patients, and it's massive. We're talking about 10 years diagnostic wandering that can be shortened, so that's really motivating, and we need that because hospital time frame is maybe 5-10 years. The pharma time frame is a 1-year budget, so you need to get the results in 12 months. The startup time frames is a couple months, so it's not easy to get together, and you need to have massive value on the road, on the end of the road, to motivate all of us. So I guess this is the driving force and make us work together.
Thibaud, any other thoughts to add?
I think, like Philippe was mentioning, it's clarifying the roles and responsibilities. I think that has been very well mentioned and clarified from the start. One maybe extra thing I would like to share is that I think we're all dreamers. Like here, we're people just that believe that we can change the world in some ways. And one of the way of doing it is in each of our jobs, finding ways with just everyday patients and sometimes everyday projects. And here we have the opportunity with something that we have all identified, which is AI. I think this is where and why we're here today. Like AI is an identified opportunity. And now the question is how this tool can help us tackle some of the challenges that we have since a long time, and that we believe that we can leverage now, that is mature enough to be leveraged to find a solution.
Perfect. And just one leaving point for the audience. Where do you kind of see the success at the end? I know we're looking to the future, but maybe a forward-thinking point that everyone can take away.
So it's where it all started for us. You can reduce diagnostic wandering. So we did it in EMEA a couple of years ago for some diseases, and I believe our system, with all this information flowing and these infrastructures we've been building for years now, we can really shorten this for all rare disease patients, meaning millions of people in Europe. So it's doable.
Maybe one thing I would like to add is really that if I put it forward, like one thing I wanted to share is that real-world data is something that often into our industry we're talking a lot about, but it's probably data that is not valued enough, whether it is on our drugs dossier, for example, but also and beyond, I would say, through this project, this is an opportunity to demonstrate that real-world data is truly an opportunity to bring solutions to the physicians and to the clinicians overall. And here it's like if we were all seated on a gold mine of data that we are talking about since tens of years, I think. And we have now the opportunity with the European context, with the French organization and structuration of data, to demonstrate that beyond the classic usage of this data, there is potentially an opportunity with AI to bring concrete solution to change the pathway of each French citizen, European citizen, and maybe beyond. And that's what I want to leave you with on this speech.
Thank you so much, and thank you to all of our panelists for their expert insights this morning. I think what we've seen with Axia today is a really clear example of how responsible partnerships between clinicians, innovators, and industry can really help bring us closer to that goal. Early and accurate diagnosis is a human imperative, not just a clinical ambition. And we also want to thank all of the partners and everyone here in the audience as well, who believes and has the conviction that collaboration is the key to moving rare disease care forward. Thank you.
Thank you very much.
Thank you, everyone.
Thank you.